Hello everyone, I am giving the X-rays of 1-day-old newborn baby focusing the chest and the right and left upper limbs. I'll repeat 3 X-rays, one is of X-ray chest and the other is in the right and left upper limbs. Is there any association or any syndrome? The X-rays are of 1-day-old newborn baby. Baby weighed 3.1 kg at full term normal delivery. This was antenatally not detected in the village-based hometown. If you want more time, please pause the video and review the images again to assess further. X-ray chest shows a feeding tube with its tip at T3-T4 level and is suggestive of esophageal atresia. Stomach shows gaseous distension suggesting tracheoesophageal fistula. The heart looks odd with bulge in the right paraspinal level, silhouetting the right heart border and the right diaphragm. Echo revealed a ventricular septal defect with dilated right heart. X-ray of right upper limb reveals hypoplasia of radius and X-ray of left upper limb reveals aplasia of the radius with both the upper limbs revealing hypoplasia of the thumb and club hands, right? Both the hands reveal hypoplasia of the thumb and the club hands. You can see the images. These are all the findings in the given pictures. I am giving the pictures of the affected baby showing the deformities in the right and left upper limbs. Please note that the ear looks abnormal and it is called as Stahl's ear, S-T-A-H-L''S. Stahl's ear characterized by the abnormal location of the transverse crest extending upward from the antihelix. Also, there was some spina bifida, and all these findings are highly suggestive of VACTERL association or VACTERL syndrome. Before going to the discussion, I want to highlight the definition of 3 things from the basics. When so many findings are noted, few are called as sequence and some of them are called as syndrome and few of them are called as association. What is the difference? When most of the findings are due to the consequences of the same cause, single cause, it is called as sequence. The best example is Potter sequence. For example, a newborn baby showing club and facial deformity with lung hypoplasia in the background of severe oligohydramnios. That's a basic severe oligohydramnios, which can be due to bilateral renal agenesis or due to severe uteroplacental insufficiency or premature rupture of membranes in the second trimester itself. So that gives Potter sequence, and that gives all these findings with the lung hypoplasia, club hands and facial deformity. So now we will go to the syndrome. Syndrome is well known for most of us. Example, with the best example I'll say is Down syndrome, which is due to trisomy 21, and all the findings are due to the genetic errors. Now we'll go to the association. What is this association? It is defined when multiple findings are present but they don't have ordered pattern for a single cause. So this pattern of multiple findings is called as association. So now I have talked about all these 3 things. So don't forget about these 3 patterns: sequence, syndrome and association. But nowadays some of the associations are called as syndrome when the basic abnormality is detected. Example is charge. Initially it was called as charge association. Once you know the basic deformity, we know and we call it as charge syndrome. Now we'll discuss about the VACTERL association or the VACTERL syndrome. VACTER association was suggested in 1973 by Kwan et al. And was later renamed as VACTERL. Intelligence of the newborn baby is usually maintained, but when there is associated hydrocephalus, it might be called as VACTERL H. In yesteryears, we called it as VACTERL association. Many say that the vast majority of VACTERL associations are thought to have a sporadic occurrence with occasional autosomal recessive forms. But some of the geneticists now call it as a syndrome due to the background of mesodermal defect from first month to second months of conception. But sometimes presence of environmental factors and association with gestational diabetes mellitus and presence of single umbilical artery add some confusion. Incidentally, in our case also, mother of the affected baby has been diagnosed to have GDM, gestational diabetes mellitus, in the 7th month of pregnancy. Please see the picture to see the time interval and the affected parts from the 25 to 55 days of conception. We will discuss about the VACTERL now. When 3 or more of the multiple organ anomalies occur by non-random chance, it can be called as VACTERL association. It is called as syndrome when it is detected with autosomal recessive inheritance. We'll go to expansion of the acronyms. V is for vertebral anomalies and very rarely V is for vascular pattern too. A acronym is for anal defects. Very rare we will have ear anomalies coming so they call it as auricular anomalies. So A. C acronym is for cardiac anomalies. TE indicates tracheoesophageal fistula due to atresia, esophageal atresia. The acronym R indicates many anomalies. It is for either renal or radial or rib anomalies. And L, last L is for limb anomalies. Now we'll go to the expansion. Vertebral anomalies, so more commonly is hemivertebrae or butterfly vertebrae, and you may have scoliotic deformity. Spina bifida is also can be, and in our case also it was there, and lordosis might be there. Very rare to have spinal dysraphism. Then we'll go to the vascular defect, V. Vascular defect is single umbilical artery which has been documented in 35% of the fetuses diagnosed to have VACTERL later. Now we'll go to A, anal atresia. Here imperforate anus is very common, and the other one is anorectal malformation. And A is for auricular defects. Either it can be very commonly preauricular tags might be there, and sometimes we have auricular defects. In our case the baby has Stahl's ear pattern, you can see that. Then we'll go to the cardiac defect, C. Ventricular septal defect is the most common defect, and second most common is the atrial septal defect. Rest of them are rare, but it has been documented. Truncus arteriosus, transposition of the great vessels, anomalous valves, tetralocephalo, dextrocardia, hypoplastic left heart, coarctation of aorta, pulmonary stenosis, patent ductus arteriosus all have been documented. The T, very important, tracheoesophageal fistula, TE, is usually with esophageal atresia and sometimes with, very rarely with duodenal atresia. Then we'll go to the R, renal anomalies. More common one is hydronephrosis. Second one is cystic kidneys, very rare to have renal dysplasia or renal agenesis, and very rare to have urethral atresia. Then we'll go to radial limb anomalies, which can have polydactyly or syndactyly or hypoplastic or aplastic radial ray. So that affects the thumb too. The radial ray usually affects the thumb too. So in our case also it was there, the hypoplastic as well as aplastic radial ray. Club hands or feet also noted. We'll go to the rib anomalies. Rib anomalies may accompany vertebral anomalies. A missing rib in a hemivertebra is also documented, and they are called as costovertebral anomalies. And sometimes you may have supernumerary ribs. If 3 abnormalities are noted, we can call that as VACTERL association or syndrome only after excluding other syndromes. The prevalence of this is 1:10,000 to 1:40,000 of live births. For definition, out of VACTERL, 3 anomalies are noted in 79% of cases, 4 anomalies are detected in 18% of cases, 5 to 6 anomalies in 3%. In our case also, so many anomalies were there. Now we will go to the incidence of each. The incidence of weight means VATE, vertebral, anal and TE anomalies, tracheoesophageal anomalies is 50 to 80%, and the incidence of CRL means cardiac, renal and limb anomalies is 40 to 50%. Some authors indicate costovertebral anomalies would be present in almost all the cases. That means all the affected babies would have anomalies either in the vertebrae or in the ribs, or most commonly in the costovertebral junctions. Whenever a pediatric surgeon sees a newborn baby or an infant with TE fistula, tracheoesophageal fistula or imperforate anus, they usually try to rule out VACTERL syndrome or association by X-ray babygram and with echo. Rarely, pediatric cardiologist wants to rule out VACTERL syndrome or association when there is cardiac defects with limb anomalies. The same pattern should be thought of by the sonologist, radiologist and the fetal specialist when detect one of the anomalies in the fetus or in the literature. They are congenital costovertebral defects. Next one is Alagille syndrome, Charge syndrome, Currarino syndrome, Fanconi anemia, Holt-Oram. If you are interested in the other quizzes in our channel, please click on to the blue colored R button to see the channel, and then above the blue colored R button you can click the videos next to the home and you will see the entire list. I am also enclosing the isolated case of tracheoesophageal fistula which had been diagnosed antenatally. You can click this if you are interested to see it. Thank you all for that. Bye bye and take care.